Good morning. Today I will present our refer to a model to determine the investment priority for telecontrolled facilities in sanitary industry in Chile to adapt to climate change. It's part of a much larger work being done in Chile with the following people: Astrid, Oddershede, with Quezada, Pedro, Palominos, and myself. I want to remind you of the water cycle. Started with raw water collection and production of drinking water, then storage and distribution of drinking water, next wastewater collection, finally wastewater treatment and restitution to the environment. The facilities we see at work are controlled. The control center is a system that supervises and/or manages and production facilities. The company under study is located in the metropolitan region of Chile. This is the agenda of presentation. Climate change affects the availability, quality, and quantity of water to meet basic human needs, thus threatening the essential human right to water and sanitation for millions of people. Under this context, Chile recognized the need for development in infrastructure. However, there are no guidelines to identify the current technological level, nor the required level, and even less the priority for technological systems. The problem situation is a real case from a Chilean company of the sanitary industry has been undertaken in order to conceive an investment plan associated with the degree of automation required to adapt to climate change. Due to budget constraints, it was necessary to prioritize plants that needed to be remotely controlled in relation to water storage and distribution and wastewater collection. The main literature used has been off-base to refer to the impact climate change. Also, Environment Ministry indicated need necessary investment in infrastructure, and Macuada present a work about the appropriate degree of automation. Nowadays, the management of water infrastructure without incorporating automation appears to be impracticable. Companies seek to increase the level of automation by allowing them to guarantee continuous service with high standards of safety, quality, and reliability, have timely and quality information, and greater adaptation to climate change. Given the facilities plans present a variety of characteristics related to automation requirements, and that there are diverse aspects that affect the purpose, we propose an approach through the development of a model that includes tangible and intangible variables. The objective of this paper is to propose a decision model to prioritize water storage, distribution, and wastewater collection process facilities according to their degree of automation required. Considering the lack of technological standard and the need to prioritize water storage, distribution, and wastewater collection process facilities according to their required degree of automation, the results of a VC analysis are combined with the results of an AHP model to obtain a weighted prioritization. A panel of experts composed of 20 people participated in the study from the sanitary industry, including directors, managers, project engineers, and operational control center engineers. AHP was applied to evaluate the relevant criteria for obtaining priority investment facilities. Regarding the methodology, the study consists of 4 main phases. The first phase consists of characterizing and determining the order the remote control facilities require automation for investment purpose according to benefits cost index results for each of the installation in decreasing way. The second phase defined the significant criteria considering technical and intangible variables such as treatment capacity, customer impact between facilities. To do, the panel of experts in the sanitary sector working in a water company must be composed. The fifth phase, a hierarchy structure, is generated to represent the problem situation, incorporating the main factors and criteria, applying the AHP method to obtain the most priority investment facilities. In the fourth phase, a weighting is made considering the economic ratios and AHP results, achieving the unified weighting for the different remote control installations. Here, applying the method indicated above, we present the results of the VC index from the highest benefit over cost to the lowest benefit over cost. We can see that all are greater than 1, which means that investing in automation is profitable from the economic perspective and the order shown in the table. Respect to the simplified AHP model, here are the levels where the main objective is determining the priority facilities to investors. And the level 1, it includes the criteria that will help to determine the priority of investment for the telecontrolled facilities. Capacity refers to the amount of water treatment in the plant during a certain period of time. Distance refers to a physical distance from the facility to the operational center control. Redundance refers to having additional elements that guarantee its operation if one of its components fails. Obsolescence refers to the insufficient performance of its functions of comparison with the new machines, equipment, and technologies introduced in the market. Customer clients or impact the clients, number the customers who are impacted by the service. And the level 2, that includes all telecontrol facilities. Regarding the results, we can see that when applying the VC index, the first recommended installation to invest is the EERR. While using the AHP model, it turned out to be the same. However, the second place installation in VC is the VES, while with AHP, the fifth place. And the third recommended installation with the VC index is the PEAP, while with the AHP model is the second place. PEAP is more important than VAS, since PEAP has greater impact on capacity, whereas VES has the greater impact to the customer. Moreover, the most important criteria could be determined, this being the capacity. The AHP model contributes giving a global weight that will give a different result if we only consider the VC index, which only refers to economic ratios. When weighting both assessments, the final order as shown in the figure is as follows.
Claudio, you have a few more minutes. Okay, you came to the results.
The past, okay.
Okay.
Conclusion. With the work, they conclude that it's possible to use AHP to prioritize investment projects for facility automation in the sanitary industry through a real case study of prioritization of variables that affect the investment remote control installation in Chile sanitary. On the other hand, the result of this study can serve a guide for the industrial process operation that need to raise their technological level and prioritize investment. The study is this reference of the criteria that can be considered to define a standard sanitary industry regarding the necessary investment within National Action Plan Against Climate Change. The values were obtained the consensus through many meetings. The results were presented in the company and were deployed values. As future proposed, generate a 5-year action plan that defines the number of facilities to be renovated and or incorporated according to the available budget. They are the main reference. Thank you.
Thank you, Claudio, for this nice presentation. Is there any question from our participants?
Yes, I have a question.
Yeah, sure.
Claudio, that's very interesting. I wonder if you consider to use your benefit cost elements of your analysis as part of an AHP model, because it seems when you multiply, you're doing somewhat similar. And why did you use it in that way? I'm just curious.
Who is asking the questions? Excuse me.
Luis.
Oh, okay. I don't see any. Okay, Luis.
The benefits, considering in the world the rentability, the industry for points, the guarantee the continuity of service, and the cost, the maintains the facilities. And in the AHP, the other variables, the intangible variables and technical variables. So capacity, for example, only quantity the water and distance behind the distance, quantity no economic.
Okay.
Okay, thank you.